Ladies and gentlemen, welcome to Paris, either in person or virtually, for this second edition of Health Tech Innovation Days. As you know, healthcare access and treatment is for every individual a global priority and has become a major concern with this health crisis. This year has demonstrated an incredible possibilities when scientists, doctors, entrepreneurs, investors, patient associations, and pharma work together to better understand how to improve human health. And these scientists, clinicians, entrepreneurs are developing and testing new medication and new tools that will enable the advent of personalized and presentative and especially much more efficient. And thanks to the European entrepreneur startups that are developing this innovative medicine. It's certain that Europe will play a major role in this transformation. Also, in every country in Europe, we have 100 companies, health tech companies, who are problem to finance their companies, to complete their products, or to access market and make them available to patients. This is very raison d'être for Health Tech Innovation Days to give the opportunity to healthcare innovation actors to meet and to form financial and industrial partnerships. Last year, I decided to launch the first HTID. It was very challenging, but Emmanuel Macron, our president, trusts HTID, and this event was under his patronage. And I am very proud to say that it was a great success. This year, it is always a challenge with the health conditions. But this event is always under the high patronage of Emmanuel Macron, our president, who will open these 2 days in few minutes by video. I am very touched by the conviction and sincerity of the president's message. I believe that the commitment of our innovative companies will be all the more effective. I now have the pleasure and the great honor of handing you over to Monsieur Macron, Président de la République.
Chers amis, dear friends, I'm very pleased to introduce this Health Tech Innovation Days. I want to start by thanking you all, participants and organizers, for setting up and maintaining this event. I've heard there are more than 300 people participating, and I'm very happy because it confirms the interest that you all have in French health tech ecosystem. Today, I don't want to make a long speech, I just want to give you a few ideas on what we've done, where we are now, and where I want our health tech ecosystem to be in the next 5 to 10 years. In France, for sure, but also in Europe. A lot has changed in the past 3 years. We've modernized France, improved funding, simplified our processes, and strengthened our startup ecosystem. The best proof of that are startups and scale-ups, such as Selectis in cell therapy, DNA Script on DNA synthesis, Biotherenity on connected medical device, MoveCare using artificial intelligence to predict relapses in lung cancer, or even Hapital to improve life at the hospital, and many more. I want to congratulate all these successes and all these entrepreneurs and researchers. But big challenges are in front of us. First, and I have already talked about this a lot, the COVID-19 crisis revealed our strong dependence on other countries for many medical products. As you know, we are actively trying to solve this issue, notably by relocating production. 1 billion euros are dedicated to this issue in our recovery plan. Relocating and cooperating with other European players, for sure, because we have a national and European strategy. These efforts on relocation are necessary, but I believe they are insufficient for our ecosystem. France remains a medium-sized ecosystem, and we know we can do much better. What's really necessary? The key to a powerful health system is innovation. First, for the patients, we need to be given access to the best treatments. And we see today that we are still, and will remain even in 2021, in dire need of innovative products such as vaccines. Second, for our social system. France has a unique social protection system, and I think the crisis showed its strengths. But this system can only be preserved if we constantly invent, ideally in France, new medicines. Last, for our economy. Boston built in 20 years a global hub for life sciences companies with very strong economic benefits for its entire region. This is an example we must look at, follow, and improve. So today my ambition is, how do we make France a world leader in health technologies by 2030? How do we make France the first European country for the production of new medicines? How do we make France the next Boston, in a nutshell? To do this, we are working on first research. Everything starts with having attractive universities and research institutions. We are getting there with INSERM, CNRS, Institut Pasteur, Université of Paris-Saclay, and so many others. We improved our ranking in the different, obviously in Shanghai Index and all the different indexes. But now, precisely now, we are passing a law to reform and modernize our system, and we are investing even more with a 25 billion euros increase in our research system in the coming 10 years, including 5 billion on health sciences. And this is working. Our research institutions are moving up in all the different rankings. But for me, it's important for you to have in mind that we are making precisely now this modernization and this investment. Second, financing innovation. We lowered company and capital gain taxes. We preserved our 30% R&D tax credit, known as the Crédit d'impôt recherche. We invested in R&D with BPI France, our public investment bank, and startups are raising more and more money every year. More importantly, last year, we launched an initiative to gather 6 billion euros from institutional investors for scale-up investments. Today, we have 24 funds labeled following this initiative and 1.3 billion raised. 9 of these funds are in the health tech sector. And we will do more in the next 2 years. 2 massive investment programs will be unveiled in the upcoming month. The first strategy will be on bioproduction with the aim to lower production cost by 100. Second, we'll invest massively on digital health, and the measures of the Health Ségur will help to upgrade our digital health infrastructure with solutions such as the digital health space or the health data hub. Third, simplicity and visibility. Starting in 2021, we will significantly simplify the temporary authorization process for medicines, but also for medical devices, to bring innovation quicker to the patient. In France, you can go fast when you want to develop a molecule. ANSM, our sanitary agency, recently opened a portal for innovative companies. For medical devices, a plan will be completed by the end of the year, especially in the field of connected medical devices. Fourth, access to talent. The most attractive ecosystems are the ones where the best scientists, researchers, investors, and founders go to. And let me say this, all of you are welcome here in France. Fifth and last, none of this can be made by France alone. We need the European market to open up, regulatory agencies to synchronize better. And we need to invent new mechanisms such as the European BARDA, which Ursula von der Leyen mentioned in her State of the Union speech. And I think this is crucial to keep transforming Europe. All this, I want it to be the core of our new agreement between the state and pharma companies, whether they're small startups, SMEs, or larger companies. And obviously, I involve as well all the investors of this ecosystem. I want the next Strategic Committee for Healthcare Industries, our CSIS exercise, which is expected to be completed by mid-2021, to focus on these issues. In conclusion, let me say this, the time will come for recovery. France needs to become the place where companies and products are invented, produced, and brought to international markets. This is our strategy, our willingness, and for that, I'm counting on you. Thank you all, and have a good discussions, good meetings, and good summit. Thank you.
Hi, ladies and gentlemen. I'm very happy to be for the second time with you all. Let me give now the floor to Thierry Breton, the very well-known actor in Europe, especially for our industries. Thierry Breton, the Commissioner on Internal Market at the European Commission. Thierry Breton.
Ladies and gentlemen, mesdames et messieurs, je suis particulièrement heureux de participer, virtuellement évidemment, à cet événement important dédié aux technologies innovantes de la santé et au soutien aux entreprises européennes des technologies de la santé, le Health Tech Innovation Day. Je voudrais tout d'abord remercier chaleureusement mon ami Christian Pierret, ancien ministre de l'Industrie en France, ainsi que tous les organisateurs Health Tech for Care et HTID Health de m'avoir invité aujourd'hui. I will continue in English because I understand that the conference is attended by participants from more than 15 different countries. In the recent months, the coronavirus pandemic has taken a huge toll on human lives, causing a dramatic negative impact on our economy and putting health and social systems across Europe under unprecedented pressure. The economic impact on our health industries has been mixed. For instance, some companies had to increase their production to respond to the surge in demand for top priorities products such as intensive care medicines or ventilators. In other cases, demand dropped as the treatment of non-COVID related diseases was put on hold. However, during the crisis, we also witnessed an acceleration in the development of new medical technologies based on cutting-edge discoveries. The pandemic has prompted a renewed urgency in unlocking the potential of digital tools in the health sector and in accelerating the digital transformation of healthcare. This is vital in order to find new medical solutions, track the spread of infection, and increase the efficiencies of healthcare systems. Digital has a key role to play here. Take the example of high-performance computing, tracing apps, teleconsultation, remote monitoring, or a common health record format.
Yes, we could applaud. Now I invite my friend Nicolas Dufour to have the floor. Nicolas Dufour deserves to be very much applauded because during those 6 last months, he was the key man for supporting companies in their day-to-day life, and we know very deeply what we owe to Nicolas in particular and to the BPI as well. So thank you, Nicolas, for your work. Thank you.
Bonjour à tous. Ça marche? Vous m'entendez? Oui. Effectivement, on a beaucoup travaillé depuis 6 mois. I'm going to go to English now. Thank you for the invitation. I just confirmed that in the past 6 months it was quite a challenge. At the end of the day, we have mobilized guarantees for 120 billion euros for 620,000 companies. So it was a days and night mobilization of my teams. And on top of that, we had some sectoral priorities, of course, which were dedicated specifically to sectors which were particularly in crisis. Of course, you would not be surprised that we focused on aeronautics, we focused on the automobile sector, we focused also on the tourism sector, we focused on the commerce sector. We tried to work a lot on industry, and notably to look at what could be relocalized, and all this represents overall a third of the recovery plan of France, which is a 100 billion euros plan, and out of the 100 billion euros plan you have 35 billion euros which are funneled towards industry considerations. And in those industry considerations, of course, you have the health sector, which has been identified, which is pinpointed very, very clearly, notably in the massive subsidy programs which have been launched, which are the first ones in, I can't even remember when it was the case before. I mean, probably 10 years ago, and now, I was this morning at the Ministry of Finance, we're implementing programs with call for proposals to companies for a total which is going to be a multi-billion program. So it's extremely useful for you to know that. It's going to be extremely important for companies. Next week on Monday, exactly Monday, October 12th, with the Minister of Health in France, I will launch the digital health plan for France, in which BPI France is heavily involved also. We have shareholdings in many startups which are dedicated to that. I am myself a board member of Doctolib, just for you to know and to feel that we are really, as we say in French, fingers in the plug, les doigts dans la prise. Hein? Voilà. So, ça fait pas mal. So last year we financed 450 projects in biotechs specifically for a total of 150 million euros. it was subsidies and loans and grants and soft loans and reimbursable advances and so forth. So that was the direct allocation of our resources to biotech and life science startups. And at the same time, we invested directly 85 million euros in equity in biotech startups. That gives you an idea of the scale of our direct implication in the sector, but we have also an indirect implication in the sense that we are financing massively, I would say, the private biotech venture capital funds. And we dedicate every year to the biotech scene of venture capital funds in France approximately 200 million euros, I would say, every year. And we had decided that it would not change in 2020, even if there is a crisis, and this is the case. So in 2020, we will overall invest in funds of funds, so in the French funds, 1 billion euros. 500 million will be to classical private equity funds, non-specifically tech. 500 will be directed to tech funds, out of which, what the president said, which are the scale-up funds. And out of the 500, 200 would go to the biotech scene. And then, with the multiplier effect, the 200 of BPI trigger approximately 1 billion euros of fundraising for those funds, only in 2020. So I think that's quite significant, and this is our sort of, you would say, rythme de croisière, so cruising numbers. Every year we do that, every year, and we don't want to stop, whatever the situation. And obviously the situation this year is very particular. We will not stop. On top of that, was decided this year in France an allocation of resources dedicated specifically to research on COVID. So what we have deployed to date is 80 million euros on collaborative projects dedicated to COVID-19. So those are loans and grants for clinical developments of treatment and vaccine. And this is still ongoing until the end of the year. And also, we have pushed to the markets an envelope of 120 million euros, which is allocated to finance projects allowing the increase of industrial capacities for the production of drugs used in the management of COVID-19 disease on the entire production value chain. So this is for extension factories, this is for relocation of production, notably, and this is loans and grants. So overall, just for COVID-19, on top of what we do for a living, I would say, every year, you can factor through BPI France 200 million euros of capital, loans and grants to French companies. And then there is the, I would say the proportion of the 120 billion euros of the state-guaranteed loans that we pushed to the 620,000 companies I cited before. A lot of those companies are tech companies. This is you need to know that, because out of the 120 billion, you have something like 15 billion which have gone to tech companies. A lot of digital companies, of course, but also biotech companies. And you see, I don't have a, for example, take Doctolib. So Doctolib has taken a prêt garanti par l'État, a state-guaranteed loan for quite a lot of millions of euros, and you have a lot of startups who took it, which is, I think, specific to France. I would be surprised that it was the case in other European countries. I don't know for the US, but I would also be surprised that in the state-guaranteed loan, the state-guaranteed loans of the system in the US, some were allocated to biotechs, to startup biotechs. I don't know actually, but it was the case in France. So, in a sum up, there's a lot of capital, a lot of money, a lot of support coming from us to the sector, and it is poised to continue, of course. Naturally. I would conclude my words by telling you that en fond de tableau, as we say in French, is in the background. We continue to push what we launched in January 2019, which is what we called the Deep Tech Plan. And the deep tech plan of BPI, which is a partnership with the French universities and the research laboratories, the CNRS and so forth, the Ministry for Health, the Ministry for Research. It's a massive plan to trigger the creation by researchers of startups. Yeah? Because if there is a little bit of a weakness in the French system today, it is not so much in the financing. I mean, we have loads of very good funds, very good teams. We have, as you see, quite a lot of money. We have the support of a very competent President of the Republic who is capable to cite all the figures by heart, including the name of the startups. So we have it all. What we still don't have enough is the real desire by researchers to create their startups. Therefore, we have launched that deep tech plan. And the principle of the deep tech plan is that we have created a whole toolbox of financing scheme first, but also consulting schemes and accompanying tools, I would say, to help them embark in the new adventure of startup creation for them. Including initiatives consisting in entwining them, researchers with managers, so that the team, a sort of complementary couple, can really push a company. It has started. It's working well. We did a tour de France of all the major French universities to come and talk to the researchers. It was a major success in 2019. And in the beginning of 2020, until the COVID started, we will relaunch it and continue the endeavor. And what we feel is that in front of us, I would say, there is a cultural change happening in the French universities, which is probably the major news that you can take back for those of you who are not French. Something is happening. There is a generation change, and again, I would say the cultural references about what is gratuity, what is startups, what's the place of capital and money, and so forth. All this is changing. All this is massively changing. What happened in the digital field in France with loads of youngsters wanting to create their digital startups out of the French engineering schools is going to happen in front of you in the French universities as far as medical devices and biotechs are concerned. So we will have a lot of deal flow. It's going to come. And then we have the deal flow, we finance the deal flow, we organize it, and we groom it. It'll inevitably lead to, I would say, good news in the creation of stable and resilient companies. So that is where we are. In a nutshell, I have teams in BPI France which are dedicated to digital health and biotech, for you to understand the nature of our involvement, which are representing approximately, I would say, 40 people. So in a bank, which is a development bank like BPI France, we cover it all, the whole French economy. Still, we have 40 people for biotech and digital health. So that shows the implication. We have funds which are dedicated to large-scale investments. We have funds dedicated to Series A, Series B. We have funds dedicated to seed. We have funds dedicated to the financing of incubators in the universities that I cited before. We have teams which are working with the universities to accelerate the technology transfer and change the culture also about the technology transfer. We have teams which are working with the ministry to properly write the law that the president described to you just before, which is a major law for the French ecosystem of research, of course. So we have decided to be, and it's not new, it's been the case for years now, to be properly equipped. So, I mean, I suppose the French people here in the room know that. And for those who are not French, or for those who are looking to us digitally, they need to know that in France there is first total commitment from the top to the library. First, total commitment, no change year after year. A sense of continuity, which is absolutely essential for success. And there is a an organization which is the bank, BPI France, which is absolutely, completely committed and has the means to achieve the vision. Thank you very much.
Thank you very much, Nicolas. Now the floor is to Franck Mouton. All of us know Franck Mouton, the president, chairman of the biotech, France Biotech. Thank you, Franck, to attend our meeting. And thank you for helping us day to day for this very important event.
Merci, Christian. Monsieur le Président, Madame la Présidente HTID, dear Marie-Yvonne, Monsieur le Commissaire européen, Monsieur le Directeur général de BPI France, Monsieur le Président d'IATL, Ladies and gentlemen, entrepreneurs, investors, corporate partners, and members of health innovation ecosystem, dear attendees. My first words will go to the members of the HTID Commission of France Biotech, and in particular to Marie-Yvonne for having initiated this international event here in Paris for the second consecutive year. Today we are very pleased to welcome all players and stakeholders who contribute to the identification, development and access to new solutions to meet patients' needs. Health tech sector is the future of medicine, and France, and more broadly Europe, is a fruitful ground for innovation in healthcare, based on leading academic and medical research. In 2020, we have been able to face this health crisis and invest massively in designing diagnostic, therapeutic, and vaccine solutions to manage patients suffering from COVID-19. At the same time, we contribute to avoid losing the opportunity to treat patients suffering from chronic diseases. This would not have been possible without digital health companies and innovation in digital health. A warm thank you to them for our loved ones who have been able to benefit from their innovation technologies. It's essential to promote French and European innovation in health, and this event is a perfect illustration of this. Medical innovation requires strong financial resources to ensure the development of solutions for patients. We would like to thank the health investors present at this event. Without their contributions and investments, these innovations would never see the light of day and reach patients. This health crisis has particularly highlighted the universal good that is health, and it seems important today that the health authorities, in the broader sense, like regulator, evaluator, payer, contribute as a trust third party to support developments in order to optimize the probability of access to patients of our innovations. It's one of France Biotech's major projects for 2020 and 2021 to strengthen the dialogue with health authorities in France and in Europe to promote this kind of public-private partnership for the benefit of patients and obviously healthcare systems. Dear attendees, France Biotech, which has been helping to bring together companies in the health sector for more than 20 years, has created this event with patients' interest in mind. The aim is to build partnership between health tech and financial players so that all patients can have access to the most advanced technologies and care. I would like to thank you for your presence at this event, both in person and virtually, and wish you a fruitful event, full of meetings and partnerships in the service of innovation of patients. We wish you an excellent Health Tech Innovation Day. Thank you very much.
Thank you, Frank. Now I'd like to call Mrs. Alexandra Dublanche, Vice President of the Région Île-de-France, in charge of economic development. Alexandra Dublanche plays a specific role today because she has the responsibility for Île-de-France region to drive the Venture Center of Excellence for this key region that represents about half of the French economy of innovation. Thank you for attending this meeting. The floor is yours.
Thank you very much. Dear Marie-Vonne Yance, President of Health Tech for Care, dear Franck Mouton, President of France Biotech, dear Mr. Dufour, Chairman of BPI France, many chairmen and CEOs today, CEO of HTID Health. I want also to thank Jean-Marc Borez, Managing Director of HTID Health France, and also Alain Godard, Chief Executive of the European Investment Fund. The President told you all the assets of France in terms of healthcare industry. I could continue with the Paris region assets in this industry. Paris region is one of the leading economic and scientific region in Europe, especially in the field of life sciences and health. We are also the first region in Europe in terms of R&D spending and patents. We have highly competitive and renowned higher education and research centers, and I could continue on and on, but this is not the point of today. I would like to focus a little bit more of the launch of the Venture Center of Excellence. About 1 year ago, I had an important phone call with the president of HTID Health Europe, Mr. Alexander van Gabin. We had strong competition in Europe for setting up the Venture Center of Excellence. But with the president of the Paris region, Valérie Pécresse, we were determined to do everything in our power to attract this amazing 15-year financial joint program between HTID Health and the European Investment Fund in Paris. We offered to help with a subsidy of 2.2 million euros to start the activities of the Venture Center of Excellence in the Paris region and also to build the future building it will move in by 2023. 1 year later, I want to say that it is a great honor for us to be here for the official launch of the Venture Center of Excellence. And I would also like to thank all the members of the EIT Supervisory Board who have taken this decision. It's a real privilege for us. We are talking about a financial vehicle designed to increase co-investment and strategic connections across Europe's innovative life science and healthcare startups, and for which the total value is expected to exceed 2 billion euros. Considering the world-class networks of both HTID Health and the EIF, I am confident that the Venture Center of Excellence will become a game changer for the European health and life science innovation landscape. It will also fill a gap in the European health innovation sector. And I believe that in these uncertain COVID times, it is all the more important for the European health industry landscape. Believe me, you won't regret your Parisian choice. The Venture Center of Excellence will be an amazing addition to our top-class health sector. As you know, Paris region is among the leading areas worldwide in the field of health and life sciences, whether it is from a scientific or economic point of view. We are the first region in Europe in terms, I said it, in terms of R&D spending and patents. We are the first economic region in Europe. We have platforms that gather in a single place scientific and clinical research, training and companies incubators such as the Spine and Brain Institute or the Vision Institute. You can also find innovation clusters such as Medicine and HTID Health France that we are very proud to host. In a world where data is key, it was said before, especially in the health industry, we have one of the strongest AI research community in the world. We also have startups that are disrupting positively the health sector, as Okin, which won our first AI for Health challenge with Gustave Roussy in oncology. I don't have time to tell you here now all of our assets, but I guess that if you are here all today, it certainly means you already know that. I just want to conclude by telling you that health and life sciences are strategic fields for the Paris region and our President Valérie Pécresse. No later than 2 weeks ago, we have presented our 2020-2022 strategic roadmap for the sector. Our new strategy includes a lesson learned from the crisis, such as the lack of health sovereignty and the fact that our public health relied too much on goods and services from third countries. With medicine and all major players of the health ecosystem, including EIT Health France, our ambition is to establish a real long-term dialogue with the ecosystem and build a common roadmap. First, to strengthen SMEs of the health and life sciences industry. 2, to support hospitals to make the best value of their data for the benefit of patient health. 3, to make Paris region a hub of excellence for bioproduction and biotherapies in partnership with France Biotech, that I wish to thank. To accelerate the use of innovations in hospitals, to promote research, technology transfer, scientific culture and education, and finally to promote internationally the excellence of the Paris region ecosystem. Each of these topics has been materialized by concrete objectives and measures, as well as funding. The Paris region funding will generate a total investment of about 215 million euros. Mesdames et messieurs, dear attendees, we have in Europe and in the Paris region amazing talents and a vibrant health ecosystem. And now we have a serious financial vehicle to support our innovation as it deserves to be. The Venture Center of Excellence is simply the perfect tool in the perfect place and in a historic momentum where the entire world is expecting innovations from the health industry to overcome the pandemic. You can count now in the future on the Paris region's support. Thank you for your attention.
Thank you very much for this important partnership, a new one. And this partnership underpins the reality of the collaboration and the partnership with HTID and EIT Health. And Marie-Yvonne insists day to day for this fruitful and very, very key for us collaboration and partnership with Health Tech EIT Health. Thank you. Thank you.
Thank you so much. So good afternoon, I'm Jean-Marc Bourrez, EITLS France Managing Director and the head of the Venture Center of Excellence. We have been working for a couple of years to shape the Venture Center of Excellence, which is a first in-kind pioneer program designed to concretely bolster the European life sciences ecosystem by connecting diverse investor types in an exclusive community. It has been a long way to make it happen with our European Investment Fund colleagues that we have the pleasure to welcome today in Paris. And the reasons for launching this Venture Center of Excellence program at the Health Tech Innovation Days in partnership with Health Tech Fokker are threefold. May I have the slides, please? First, the event gathers together investors from across the international ecosystem. Second, the Région Île-de-France, as it has been said by the Vice President, has provided strong financial support to install the VCOE operational team here in Paris. And last but not least, as we have heard from the previous leaders in this session, cooperation is increasingly key to delivering results. And this is precisely what we did in the last couple of months to make it happen. So today we have the pleasure to be joined by leadership from EIF, European Investment Fund, and EIT Health, who will speak about these historic initiatives. So I'm delighted to introduce Hubert Cottoni, EIF Director and Head of Mandate Management at the European Investment Fund, and Jan-Philippe Beck, the EITL's CEO. Let's start with Hubert. Hubert, the floor is yours. Needless to
address the second edition of the Health Tech Innovation Days. It's being held in unusual circumstances, and I would have liked to be personally in Paris, but as has been expressed, some of my colleagues made the way to Paris, and I would really like to encourage you to mingle and meet up with my colleagues, because indeed the Venture Center of Excellency has merits, but needs a framework, needs the partnerships, and this event should allow us to foster this partnership to really make it grow and make it impactful. The digitalization of conferences and events is something we are all seeing more of as the COVID-19 pandemic forces us to change our ways. In a way, it is accelerating the shifts in technology and behavior. And the same can be said for healthcare and life science sector, where we are seeing that COVID-19 has intensified disruptive activity. Whether it be pharmaceutical, medical devices, or digital health technology, Europe is home of thousands of startup companies that are developing innovative, life-saving treatments and therapies for tomorrow. Now, COVID-19 pandemic has underlined the importance of these efforts to ensure the health of citizens and the Europe economy. At the same time, however, we need to ensure that these businesses receive the funding they need to support their innovative and disruptive potential. To maintain our strategic autonomy in Europe and in the healthcare and life science industry in particular, European innovators must have the adequate means not only to start up in Europe, but also to grow here. We cannot afford to see European companies and businesses to seek financing elsewhere, in particular when they are looking for scale up and when they are moving up to the next level. This is why, in collaboration with EIT Health, the European Investment Fund has developed the Venture Center of Excellency. It is the first of its kind true open innovations platform, which brings together the life science industry by large on a European scale. It will promote the collaboration, but also the investment sharing between the European life science VC players and top-tier corporates from the medtech and pharma industry for the benefit of small and medium enterprises, of startups and scale-up companies in Europe. What I would like to emphasize, this would not have been possible without the great support and the belief of the European Commission. The European Commission has committed to become a cornerstone investment to this initiative. And it is via the European Fund for Strategic Investment, EFSI, through which the European Commission is committing initially 75 million euro and will match any future private funding coming into this Venture Center of Excellency up to a total commitment of 150 million. A big thanks goes to the Commission because indeed, heard before, the process took some time and the Commission was indeed the first one to really strongly commit also financially to this project. But what we are really counting for is commitments from private investors. And this is why we do this. And this conference will give us the reach and the possibility to reach out to all of you, but in particular the pharma industry, the medtech and the health insurance companies, but also to the national promotion institutions. As we have heard just before, how important BPI is and will continue to be for France and the health sector in particular. So it's really a plea to the corporates and the national promotional banks to look at this as a true partnership and the potential to support the European community and to increase its firepower. Ultimately, these efforts will contribute to protecting our innovative ecosystem to ensure that disruptive and innovative businesses in the health and life science sectors have access to financial support, the financial support they need to grow, and at the same time are able to work and seek for this cooperation and this collaboration with European corporates, and by doing so, attracting talent and innovation from beyond the European borders. This is, in a nutshell, what the Venture Center of Excellence is all about. It's a true partnership from public institution to private institution, from corporates to small and medium enterprises, to make this industry not only to innovate here in Europe, but to truly scale up and grow in Europe. Thank you very much for your attention. I wish the conference a big success, and I hope to hear from the results very soon. Thank you very much.
So, while Jan Philipp Beck, our EITL CEO, is trying to connect by voice, because actually he's connected remotely with his laptop. Let's go through a couple of things before ending this session. So we have been working for a couple of years to shape the Venture Center Excellence, which is the first in-kind pan-European program designed to concretely bolster the European life sciences ecosystem by connecting diverse investor types in an exclusive community. This community is actually represented by different type of big players on the marketplace and the European scene of life sciences. So concretely, the partners of EITLs will acting as potential co-investors within this program, which is a unique and concrete response to the goals and the strategy outlined in the first half of this session, namely by providing new support mechanisms for the European life science ecosystem. Yeah, it's okay. So apparently the technical issue is apparently solved. So Jan Philipp, please, the floor is yours. Hey, that's fine, excellent. Go ahead, please.
So good afternoon, ladies and gentlemen. I'm very sorry for this technical error. I heard recently in one of these online conferences that somebody said that, "Can you hear me?" was maybe the mostly spoken sentence of the last 3 months in meetings. So I'm very sorry that I had to give you the same sentence now as my first one too. But I think you can hear me. So ladies and gentlemen, distinguished guests, honorable guests, my apologies that I'm not able to be with you today in Paris in person. I reach out to you from EIT Health in Munich. So EIT Health is the leading European innovation network under the umbrella of the European Institute of Innovation and Technology, which is the body of the European Union. So who's part of it? It's a total now of 150 top organizations, a third of them about from industry. We have then research institutes, distinguished universities, healthcare providers, cities, regions, and of course also payers. So you may say the key ingredients you need to make healthcare innovation happen. So we support innovation in health. We have the capabilities to connect and facilitate the key stakeholders. Our network is truly our strength. So we provide education and training. We accelerate the launch of new products and services and business models to market so that they can actually benefit patients and citizens out there. Startups are, of course, a key part of our ecosystem. 750 we have supported to date all over Europe. We provide access to stakeholders, to knowledge and expertise, and this is very much our topic today, of course, also to finance and investment. Now, the idea for the Venture Center of Excellence, or the VCOE, goes way back. So as early as 2016, 2017, I would say the back then embryonic idea of putting a novel and innovative co-investment platform on the map of Europe was developed. Today, the baby is born, thanks to all those who have been there at the table right from the start and who are also in this room today or connected virtually. The European Commission, and of course the very committed team from the EIF, last but not least also my own colleagues under the leadership of Jean-Marc Bourrez, who's there with you today and to whom I'm deeply grateful. The guiding idea has been to leverage the strength of powerful European players and institutions, the EIF, European Commission, as well as the capabilities of EIT Health, and of course the firepower of private investors, potentially also institutional investors like healthcare payers or insurance, to provide the strongest European entrepreneurs with an entirely new financing opportunity. So since the idea was conceived, the world has turned a lot. So as the previous speakers have outlined, the need for modernizing, digitizing our healthcare systems has become even more evident in recent months. The need for innovation in healthcare at all levels is evident and understood. And all of this is happening while we are in the midst of an economic crisis that we, I believe, are still trying to fully comprehend, and that actually represents a vital threat to our well-being and the sustainability of our healthcare systems. So the VCOE comes absolutely at the right time. So how will EIT Health contribute to this unique European endeavor? There are three key items that are essential. First, we will feed startups that address urgent patient needs that build on new technology and new business models to the ecosystem. We facilitate the exchange of investors with industry leaders, breakthrough academics, researchers, and entrepreneurs. And we will encourage and support strategic corporate investors in capitalizing on the opportunities that the VCOE will represent. So the VCOE has found a home in Paris, and I'm very grateful for the generous support that we receive. There could be no better home as a platform to engage and reach out to all over Europe. So I'm looking forward to making the next steps happen, and it's an honor for EIT Health to work with all of you to make this a remarkable success. Thank you very much.
Well, thank you so much, dear Jan-Philippe and Hubert, for your inspiring words. As you can see, the VCOE program is unique and a concrete response to the goals and strategy outlined in the first half of this session, namely by providing new support mechanisms for the European life science ecosystem, promoting European sovereignty in a key strategic domain in this current COVID-19 context and beyond, leveraging regional, national, and European support to deliver concrete market-based solutions, aligning European bodies by breaking down the silos, as we've heard from our European Commissioner, and creating, last but not least, creating a public and private partnership to impact the market designed and conceived in a bottom-up manner, thanks to our partners that have been instrumental to make it happen, even if it doesn't mean that they will subscribe at the end, but all those partners decided to make it happen together alongside the European Commission and the European Investment Fund. This program is unique, and the dedicated session that will give us the opportunity to discover in more detail the key components of the Venture Center of Excellence program is a big opportunity to deeper discover this amazing program that aims to be developed in European countries for the following 15 years, and that aims to reach at least 2 billion euro of co-investment capabilities within the European-based market. So thanks a lot, and I'm inviting you to join the following sessions with one open session that will be dedicated to any attendees here today, and with two parallel sessions which are only focused and dedicated to partners of the EIT Health and EIF community to get access to more deep knowledge and deep understanding of this Venture Center of Excellence program. With two sessions, EIF Market Insights first, that will be led by our colleagues from EIF, and the second session shaping the member community vision. That means that we will have to, in the following weeks, to finalize the building up of this community throughout the three period of time that will get access to more investment capabilities in the following weeks. Thanks a lot, and I would like to thanks a lot Marie-Yvonne Jans, the chairman of the Health Tech for Care, for having accepted to co-organize this session with us, and all the people and partners that have decided to make it happen today. Thank you so much, and I wish you a good meeting.